Hi, welcome to Beyond the Paper Gown. I'm Dr. Mitzi Crockover. As we all know too well, our skin goes through a number of changes as we age that require special attention and care. And I had the pleasure of sitting down with a renowned dermatologist and skincare expert to pick her brain about what we can do to best care for our skin and also learn about the latest techniques available to refresh and rejuvenate our look. We have so much good information, I've divided our conversation into two parts. In this episode, you'll hear tips and advice on how to maintain healthy-looking skin. We'll cover everything from the components of a daily regimen to lifestyle changes that can make a big difference in your skin's health. The second episode will review options like laser and microneedling, as well as how to choose the right practitioner for your skincare needs. Before we get started on today's episode, I'd like to invite you to subscribe to our podcast on your favorite platform. That way you won't miss the second part of our episode or any of our other interviews with leading professionals in women's health. And if you enjoy our podcast, please let us know by submitting a rating. That helps us rise to the top so others find us more easily. And just a reminder that our podcast is intended for information and entertainment purposes only and is not to be considered medical advice or a substitute for your healthcare provider. I am very happy to have our guest today because she's going to answer all my questions about dermatology and skincare, and hopefully yours as well. Dr. Monica K. Lee is a double board-certified dermatologist in Canada and the United States and a clinical instructor in the Department of Dermatology and Skin Science at the University of British Columbia. She practices in Vancouver and serves as a consultant for various international companies in the field and is author of numerous book chapters and peer-reviewed publications. So good to see you, Monica. Thank you so much for being with us.
Thank you, Dr. Crockover, for having me. It's a pleasure.
Well,
Thank you.
You're going to call me Mitzi first, right?
Okay, that sounds great. Thanks. And please call me Monica, too.
I appreciate that. Thank you. Absolutely. What are some of the common skin concerns that women our age, or my age, I should say, may face that you see in your office?
First of all, my patient practice covers really the full age spectrum from 18 and up. And certainly I take care and provide, advice, education for a lot of women over 40. And it's really wonderful to see many patients care about their skin, because when they come into my practice, they're not trying to look like they're 25. They want to look as young as they feel inside. It's about restoring confidence. It's about ensuring that they put their best version of themselves forward when they go about doing their daily things in life. And so a lot of the common skin concerns comes down to skin health and skin quality, and making sure that they are looking the most refreshed, less tired, best version of themselves. And so some of those skin concerns commonly seen, even not just over 40, but over age 30, because 40 is the new 25, and we all know that now. So there, the concerns are pretty universal, right? So, women are concerned about the quality of their skin, any age-induced or age-related dyspigmentation, premature signs of aging like fine lines, wrinkles, and it's about giving a more even canvas on the skin, making the skin look brighter, making someone's shadows and skin surface irregularities a little smoother. So those are the common skin concerns, beyond if someone has, of course, skin pathology where there has to be medical management, but those are some of the more aesthetic or global cosmetic skin concerns that women over 40 often present to my practice, asking me for recommendations to improve on.
And, it's interesting that you made that point, because I do think that we've seen kind of a progression from, the severe facelifts, trying to, like you said, look 25 when you're 65, to using, I guess, more fillers, but even those seem to be if used, maybe excessively, also don't seem to be quite as real, to a more, as you said, acceptance to really just kind of looking like a better version of yourself. And so is that what you're seeing?
So my philosophy of care when I approach my patients, really at any age, is to help them age gracefully, is to give natural results, help them be able to understand the decisions that they make to be able to have natural results. There are some things that are timeless, irrespective of our age, and that is skin health. And also skin quality, highlighting features that people naturally are born with, and taking that nuanced approach, using very measured interventions that are timed short term, more intermediate term, and then longer term, so that there's a program over time that takes a holistic 360 approach to aging. And of course, then, we could then talk about, we're not talking about only treatments. Then I often counsel my patients on, I am someone that can, of course, provide these treatments for you, but you have to practice healthy lifestyle habits. So if you're a cigarette smoker, really try to not smoke. Eat well, choose a well-balanced diet, try to sleep well, try to reduce the amount of stress, exercise. All those measures are important in ensuring the well-being, both physically and mentally, of a patient. And so my role as a dermatologist, especially doing the cosmetic work I do, is just one component of that big 360-degree picture.
And I would assume that also hydrating is very important.
Of course. Hydrating with water, yes.
That's very good. Thank you for that differentiation. So let's just kind of, get down to the logistics, if you will. And that is, so, let's say someone like myself comes into you. What would be your first steps in terms of approaching the recommendations that you might give to someone like me?
So it starts with a consultation, right? Just like anything, that relationship between a physician and patient has to start with having a discussion where I'm an active listener and I understand what their values, needs, past experience, perceptions, understanding, knowledge at baseline is. So when that consultation starts, I always ask patients, first of all, what brings you into the office? Like, is it because your kids are getting married? Is it because you stayed at home for a number of years and you're trying to come back into the workforce because that's something that's important to you? Is there a big anniversary wedding that's coming up and you want to look better, or you want to look more refreshed for your photos? So and often because I understand what has motivated that patient to come into my practice, and sometimes associated timelines, it gives me a sense to help that patient plan, like I said, short-term, intermediate, and long-term. As part of that consultation process, I always start with understanding and counseling about skincare. It's really the foundation of everything that I do, and skincare is something that's important because it gives a patient a routine. So if they can't even commit to a skincare routine, it's hard for them to have that understanding of that buy-in for everything else that I do for them. Basically with skincare, we start with that first because there are so many levels of importance with a good skincare routine that's right for that individual. And I always tell my patients that there's no one size fits all. Just because a girlfriend or a sister uses a certain product doesn't mean that product is the best one for you. So we go through that, so we have a curated routine for that individual. And then I talk about treatments, and the treatments that I do, as I'm not a surgeon, are either non-surgical or non-invasive to minimally invasive. And those treatments would differ based on what, again, the patient's concerns are, what I see and visualize when they come into my practice. It could range from anywhere that are really truly minimally invasive, so laser and light therapies, to other options like cosmetic injectables, or if perhaps, for instance, they have skin tags and it really bothers them and it catches the collar of their shirt, we are looking at removing those spots. So taking care of lumps and bumps that people might have that have bothered them for a while. So it really ranges depending on what that patient comes in and what they voice to me as their priorities.
Let's talk a little bit about skincare. Can you make some general recommendations or comments? And I guess one of the other questions is prescription or the products at a dermatologist better than what we find over the counter?
That's a great question because I again, very commonly asked by my patients. To me, the non-negotiables in a skincare routine consists of a moisturizer, a cleanser, and a sunscreen. Cleanser is important, especially before bedtime, because you have the, colloquial speaking, take the day off. There's a lot of debris, there's oil, there's makeup, topical prescriptions, all sorts of debris and dirt and unnecessary elements on our skin that we want to remove so that we have a clean surface for restoration physiologically that our body does overnight. So the cleanser, especially before bedtime, non-negotiable. The moisturizer is important, and generally I tell the majority of my patients that the moisturizer should be used twice a day, before bedtime and also in the morning. And it's because there's going to be compromises to our skin barrier throughout the day with the products that we use, with the elements in the environment, with the sun. So all those different aspects can damage or compromise the integrity of our skin barrier, and hence a moisturizer helps that skin integrity be stronger. And then the final non-negotiable, as you would expect coming from a dermatologist, would be sunscreen. In fact, I argue that it is the best anti-aging decision that anybody, male or female, regardless of age, can do for themselves for prevention. Sunscreen, the recommendation really globally is that we want to at least choose a sun protection factor or SPF of 30 or higher, that it should have broad spectrum UVA and UVB coverage. And for many of my patients 40 and over who are starting to see some pigmentation, and especially women over 40, they may have melasma, for instance, a common, not so uncommon facial pigmentation concern, then a physical sunscreen specifically would be recommended. So sunscreens come in chemical or physical formulations, and a physical formulation would have ingredients such as iron oxide, zinc oxide, or titanium dioxide. So I prefer and I recommend a mineral sunscreen over a chemical one, but at least minimum have an SPF of 30 or higher with broad spectrum UVA and UVB.
Before we leave that very quickly, one of the questions that I always have is, how much do you use? Are you supposed to, is it just supposed to be a thin film?
The ideal amount for sunscreen application probably is much more than what an average individual would end up using, because to cover the head and neck region alone, it should be a golf ball size amount or a shot glass.
Wow.
Worth. So it's most people do not end up using that amount. And because of that, many of us in dermatology, my colleagues, would recommend a number greater than 30, hoping that a higher SPF number would compensate for the fact that the average person, probably myself included, don't use the ideal amount. And then once we talk about covering not just the head and neck area, because it also there's other body sites that see the sun, such as the hands, the forearms, the legs, then you can go through that bottle of sunscreen pretty quickly if you're using it ideally. Yeah.
Thank you. I interrupted you. I hope you didn't lose your train of thought.
Oh, no. So I was just saying that the non-negotiables are cleansers, moisturizers, and sunscreen. If I have someone over 40 especially, I would then also discuss with them the use of topical retinol or retinoid vitamin A and vitamin C or ascorbic acid topically in the morning. And the role of these two agents combined with sunscreen, we call a trifecta, is because of retinol or retinoids. Vitamin A, which is what retinol or retinoids are, vitamin A has been proven for many years and used by all my colleagues for rejuvenation. So we can use it to help with cell turnover. We can use it to stimulate a bit of collagen, to reduce uneven, unwanted pigmentation on the skin. So there's many merits of retinol for improving and reducing many of the signs of premature aging that bothers many women over the age of 40 or even 30. And that's used at nighttime. That product is used as a thin layer because of the fact that it helps with cell turnover. It can cause some dryness. So that is used as a thin layer. And always paired with a moisturizer to offset or mitigate some of that dryness or slight irritation that patients may have, especially with initial use of the product. The topical vitamin C or ascorbic acid would be used in the morning, and that can be started and used every single day in the morning. And the benefit of using topical vitamin C is that it's a known antioxidant. So it helps with cell damage repair, primarily due to UV exposure, but even any environmental aggressors that might impact or damage the skin during the daytime through our daily activities. A topical vitamin C underneath a moisturizer and sunscreen can help with that. To your question about whether over-the-counter or prescription is better, I think it's important to understand that, like, when we use anything that's prescription, these options are initially designed and studied for skin pathologies. So if we talk about prescription retinoids, initially they are indicated for use to improve acne. And so they tend to be a bit more potent than over-the-counter options. And there are many over-the-counter retinol options with the formulations that have been tweaked so that the tolerability of that product is improved. There are so many products in the market now where there's lots of options for the average consumer, different price points with different ingredients. And I think I always educate my patients to look at the ingredients as opposed to look at the pricing or the brand. Because then that's when you can really leverage the benefits of those ingredients as much as possible, rather than thinking that, well, if I buy something really expensive and it's $300 for a product, then I know it must be good for my skin. And, having a good skincare routine with all those benefits doesn't have to break the piggy bank.
Okay. So what are some of the ingredients that we should be looking for? Are there any things that we should be avoiding?
I'm going to start with avoiding first. So, and especially now, a lot of us, women over the age of 30, 40, we choose to study longer. We choose to evolve our career. So lots of women are having children later in their life than, say several decades or several generations ago. So retinol or retinoids, if someone is pregnant or breastfeeding, it should not be used during those time periods, and it can be resumed once breastfeeding and pregnancy is done. And then other than that, and there's not ingredients specifically per se that someone cannot use. I would argue that it's more judicious use of a product. So using it based on what your skin tells you can tolerate. So anytime anybody starts a product, if especially they have more sensitive skin, which is a common concern that a woman over 40 or in general female, any of my patients come in, might let me know, start by using a product as a test spot on the wrists or on the back of the ears for a few days. And if you find that the product is it's well tolerated, then you can have more assurance if you were to use it more generously throughout the entire skin surface of the face, neck, and chest, or hands. Unlikely you're gonna run into issues with that product.
Before we came on, I told you that my daughters, who are in their 20s, had a question for you. When should young women start thinking about their skin, and what can they do to prepare to age gracefully?
Yeah, for my younger patients, I tell them, you know what, use your sunscreen religiously and diligently. That's the first thing. Second, don't bake in the sun. No matter what peer pressure or what other people are doing, you have to think long term. So it's okay to go on a sunny vacation. It's okay to go for a run or a walk, but make sure you have that sunscreen on. Try not to do it between peak hours, between 11 a.m. to 2 p.m. during the day, and wear a hat, wear UV protected clothing as much as possible. And for younger patients, sometimes, tanning salons and tanning booths are unfortunately still quite prevalent in society. And there's a lot of misconceptions and marketing done around tanning that's still pervasive. So making sure that they never, ever go to a tanning salon or a tanning booth to get, the pre-vacation color that patients often think that they, want. You can use a tanning spray, and that, you could adjust the color as much as you want with a tanning spray. That's that's not harmful. It's harmless. And if you just want extra color, then that's a great way of adjusting and doing so without actually damaging the skin. And the prevention is key when it comes to young patients, making sure that we don't have the sun get to them, because a lot of then the premature signs of aging that women over 30, over 40, over 50 then see a dermatologist for, whether it's for cosmetic reasons or for medical reasons, because their skin cancers comes from cumulative exposure during their younger years.
I grew up in Texas, and I remember putting baby oil on and sitting under the aluminum foil, and I'm a redhead, and that was not the smartest thing in the world, but and my tan was unnoticeable, let's put it that way, so it really wasn't worth it. And so I'm so grateful that my daughter's the first thing that they think of. It's kind of like wearing seatbelts. They do
Yes.
wear sunscreen. So there's been a lot more recognition, as we talked about, of menopause in the media, and also companies are appreciating this age group, and there have been a number of new products, especially skin products, on the market targeted at women of menopause age. Do they have some kind of secret sauce, or is that just marketing?
It's important that despite changes that we may see on our skin as we get older, to stick to the principles and not let some of the, I wouldn't say fears, but maybe some maybe insecurities around aging, to have someone capitalize on that. So sticking with the principles, as I mentioned earlier, including having a consistent skincare routine with ingredients that are tried and true. And sure, some of these formulations, if you read the label, they certainly can have those ingredients, and it's not to say that they are not good products or products that don't work. But it's not necessarily important that someone who is approaching menopause or in menopause have to choose a product that have been targeted and have marketing messaging that is saying that it's specifically for that age group.
Well, Dr. Monica Lee, thank you so much. It's a privilege having you here. I've learned a lot and have been taking copious notes. So thank you so much for being with us.
Thank you very much.
I hope you learned some new information about skincare. I know I did. As always, check with your own healthcare provider with any questions you might have about your specific needs. And before we go, I do want to underline Dr. Lee's comments about lifestyle. Sleep, nutrition, and exercise can all enhance the health of our skin as well as our overall health. And I invite you to listen to our second episode with Dr. Lee. We'll get into the nitty-gritty about skincare procedures as well as what to look for in a practitioner. She's a wealth of information. In the meantime, we'd love to hear from you about your own skincare routine and any questions you might have. You can share your comments by following us on Instagram, Facebook, and TikTok, as well as on our website forum at beyondthepapergown.com. As always, thanks for listening and be well. Our podcast is produced by Patrick Shambayati and me, and our associate producer is Kyla McMillian.